We are what we consume, food and drug interactions and the things we may overlook, by Dr. Sean A. Valdez, PharmD. It really is amazing what we put into our bodies without giving it a second thought, whether it's the food we eat, the air we breathe, the water we drink. It is not as pure as we'd like it to be, but we give it no second thought for the most part because we need it to live. Now, consider all the other things that we take in that, in addition to those above, are necessary for living a healthier life. The medication we take, the supplements we add to it, the over-the-counter items we purchase to add to that. They all exact a measure toll, and we don't know when, why, or how we will come to pay it. No pun intended. But I want this to be food for thought for you as an empowered patient. I want you to think for a moment about the myriad items that you might be taking and let yourself think about how they all interact or potentially interact with one another. To that end, I want you to think not only of those things you know of, which interact by interfering with each other, but with the things you may not have ever considered. That is why our pharmacy team at Olympic Pharmacy exists and why so many in our profession do what they do to empower you as the patient to be armed with the knowledge you need to protect yourself and your family and friends from the things you may not have even considered. It's no secret that everything we take or are prescribed is not always going to play nice in the sandbox. This is the inferred, inherent, and acceptable risk of better living through chemistry. For even the most innocuous of medications or supplements of foods can have unexpected deleterious effects. Let us take, for example, the simplest and often overlooked drug, alcohol. Its known effect singularly claims 178,000 lives annually, making it one of the leading preventable causes of death in the United States. This only tells a small part of the story. The leading cause of death globally, according to the World Health Organization, is ischemic heart disease. It claimed 9.1 million in 2021, representative of 13% of all cause mortality worldwide. The largest part of this statistic is a lifestyle characterized by the use of alcohol and tobacco as key drivers to comorbidity. Through my professional journey, I have come across a great many patients who readily accepted the inherent risk of alcohol and tobacco use alone, but they never connected the fact that both alcohol and tobacco can exacerbate other conditions they might be treating with prescribed medications, conditions that, ironically enough, were brought about by alcohol, tobacco, and lifestyle. Furthermore, and most importantly, they had not yet considered alcohol and tobacco's respective impacts on the patient's medications as it pertains to metabolism, breakdown of medications, and their ensuing pharmacologic effect. The powerhouse of all metabolism and drug breakdown starts with a healthy, functioning liver. It is the key component in identifying successful outcomes as it pertains to drug therapy, especially for those medications metabolized in the liver. Drugs cleared through the liver have specific pathways, and those pathways are integral pieces to the effectiveness of a drug as much as it is to the drug's adverse effect profile or expected adverse effect profile. Consider a healthy liver. No problems in function or encumbered by disease. Most medications are quickly and easily metabolized. The adverse effects tend to be lesser in degree, and the intended effect is generally clear, clean, and precise. Conversely, as years age this hepatic behemoth, fewer viable receptor sites are available for drug metabolism. Its processing ability slows down, hence the need for adjustment when the body ages. Added to alcohol and a high-fat diet, as well as other hepatically cleared medications, and you increase the risk for drug interactions, drug-food interactions, and drug-alcohol interactions. You increase the intended effect of one drug, decrease the intended or desired effect of another or several, and then other organ systems may begin to slow down or, in some instances, shut down completely. Those are the direst of circumstances and yet are the most preventable. The best medicine for this is your pharmacist. We are always there to answer your questions and address your concerns, especially as it pertains to you, your health, and the health of your loved ones. It is not always an easy battlefield to navigate, but you needn't do it alone, especially with newer medications and supplements becoming available to us every year. On average, the Food and Drug Administration approved 38 new medications per year from 2010 to 2019. Additionally, over 1,000 new dietary supplements are introduced annually. This does nothing but add to the confusion of the world of appropriate and safe pharmacotherapy. Furthermore, some foods we consume can impact a drug's bioavailability and result in effectiveness. For instance, most patients I have counseled taking levothyroxine, a drug commonly prescribed for thyroid dysfunction and a disease that affects more than 12% of the United States population currently, don't realize that it must be the sole drug taken before any other food, drink, or medication due to its best absorption effect on an empty stomach. Another drug class affected by food is the antibiotic drug class. Some need to be taken with a meal, some should not be. Tetracyclines, for example, are often chelated or bound by something as simple as milk. That is due to calcium in the dairy product. There are so many medications out there intended for a healthier life, but what we don't know and don't learn about them can literally kill us. Here at Olympic Pharmacy, we are here to help by educating you and your loved ones and by arming you with the most up-to-date knowledge to provide better outcomes for a safe and healthy life. Olympic Pharmacy is located at 4700 Point Fosdick Drive in Gig Harbor. You can reach them at 253-858-9941 or www.olympicpharmacy.com.